Good morning. Yeah, Barry Rheault, and I'm a chiropractic physician, and I'm here with Dr. Mork. Actually had a procedure from him last December, about a year ago, for an SI debridement procedure. He's having quite a bit of pain in that area.
Sacroiliac.
Yep, sacroiliac. And you know, the first thing that I noticed about Dr. Mork that really appreciated, my wife was with me, and she mentioned the same thing, is just how good of a communicator he is. And he really listens to the patient, and that just means so much. And as a retired chiropractic physician myself, we were taught that really about 85 to 90% of your diagnosis is picked up during the history. So, you know, with Dr. Mork being such a good communicator and listener, we just both felt, my wife and I both felt, that just the diagnosis, we felt very good about, you know, what he came up with as far as the diagnosis, just from his listening skills and from the history. And, you know, once you have a good diagnosis, then I think you feel more confident moving forward that you're going to get a good outcome. And of course, the other thing with him is that, you know, he's done thousands of these spinal endoscopic procedures, and probably more than just about anybody in the world. So you just have the confidence, you know. It's as they say often, you know, there's just no substitute for experience. And so he's just done so many of these procedures. So if you have a good, accurate diagnosis, and you can pick that up from your history by being a good listener and a good communicator, as Dr. Mork is, and then you have the experience to apply the correct treatment for the proper diagnosis and do it the best that can be done, because again, he's done thousands of these procedures, and so we just had such confidence that he was going to do a great job for me. And so I had the good diagnosis, I had the great treatment from him, you know, from the endoscopic sacroiliac debridement procedure, and it's been about a year now, and I'm just so much better. I was just telling him a few minutes ago that the last couple of months has been the first time in really 4.5 years that I've been engaged in life again. I mean, I'm a health coach now. I had to retire from chiropractic because of back issues, and I'm a health coach now, and helping people to lose weight and create health in their life. And it's been the first time, again, like I said, in about 4.5 years that I've just had a positive attitude and a smile on my face. I've been able to talk to these people and help them, and just felt like getting up in the morning and doing business and helping people. And, you know, I'm able to work out again. Everybody around me seems so much happier. I know it's me, but you know how that goes. And just everything's improved. My relationship with my wife, you know, we've been married 22 years now, and you know, she stood by me in the tough times, but now we're able to enjoy life again like we were before. So, you know, you got the improved relationships. It's like you've heard, it's kind of, you know, just the old saying that you always hear is, you know, he's given me my life back. And that's what I feel like, is that through this procedure, I've just been able to get back to where I was before. Like I'm back on top of the mountain again, instead of just in that chronic pain situation where you just you can't function. You know, you're just thinking about that all the time, and you just can't live at that high level of life that I was used to living at on all levels, and you know, with my work, my relationships, my finances, everything. So it's just good to be back there again. So I'm very grateful for Dr. Mork for that.